Doctors of Reddit. What's the worst thing you've seen for a patient that another doctor overlooked? Broken neck. No, really. So this one guy was brought in with an ambulance for upper airway obstruction. We diagnosed what looked like an advanced throat cancer and did a tracheostomy. After the operation where you pull and push the neck like crazy, we checked his neck x-ray and a junior asks when did he break his neck. He had a brand new unstable neck fracture. Checking his initial x-ray, we see that it was there prior to the operation. After questioning the patient, he said that on his way to the hospital, the ambulance was in a car crash. No one bothered mentioning it to us when he eventually came in. He only thought that he had some whiplash, but he was a few millimeters away from permanent paraplegia. Unfortunately, he passed away about 2 weeks later due to the cancer. This guy had absolutely nothing going for him. Like, come on. This man is like prime unlucky. I'm sorry. We now have a Discord. Check out the server in the link in the description. Story 2. Patient was lactating, but not pregnant or breastfeeding. Previous doctor told her it was residual from her baby that had weaned for 14 months. Sent her immediately for a brain scan. Brain tumor. She had surgery a week later to remove it and is doing very well now. Edit. Wow, I didn't think anyone would even read this, or I would have to explain it better or try to sound a bit more professional. I did not do any of the follow-up care. She left my office with a referral for an MRI and a referral to an endocrinologist who took over care. Also, please, if you're concerned about your health in any way or are not happy with your doctor/care, obtain your medical records and bring them with you to a different doctor. Don't solicit medical advice from strangers on the internet that know nothing at all about your medical history. That is very dangerous to your health. Story 3. My husband had a weird dimpled spot on his back. Went to the dermatologist multiple times. Was brushed off and told not to worry about it. Derm even burned off a nodule that was bothering him at his belt line, but repeatedly said that it was nothing, and was visibly irritated with us for being anxious. We waited for nearly 10 years before going to another dermatologist since our experience was so negative. Next, derm immediately diagnosed what turned out to be a sarcoma, which had now had an extra 10 years to grow. My husband now has a 48-inch scar snaking down his back from the removal of the tumor and the reshaping of his back. I now have months of experience with wound drains, tunneling, bandages, triage, and the laundry that comes with massive wound healing. I would like to take that first dermatologist who is so freaking patronizing with our concerns and shove his face deeply in his own butt. This sounds like the most frustrating thing in the world. I'm so lucky something like this has not happened to me, but it's so annoying to hear about. That doctor just gave a terrible condition 10 years to proliferate and manifest, or I don't know the word for it. Condition get worse, man get sicker. And it's all because this doctor misdiagnosed and was very confident in it. Story 4. I suppose I have one for this as a resident doctor. We saw a kid in the emergency for difficulty walking. He had been slowly losing the ability to walk over months, and also had random unexplained projectile vomiting episodes. Looking at his records, he saw his doctor several times who x-rayed one hip, then the other hip, gave some Zofran, etc. Turns out on exam, he is blatantly ataxic, bad coordination, and can't even stand. Failed all our bedside neurological examinations for cerebellum function. It was obvious to me, and I'm not even good at this yet. Did a CT scan. Huge tumor in his cerebellum. It was obstructing fluid drainage in his brain too, raising his intracranial pressure and causing the vomiting. Had to call in the neurosurgeons overnight for emergency drain, and he went to the ICU. Later had more surgery for the tumor. My supervisor got pretty emotional about it actually. Story 5. My best friend was in her late 20s and was feeling constant irritation in her stomach. She went to see several doctors over the course of almost 3 years, and they all dismissed her saying she had an irritable bowel. She would try a new diet every few months, but nothing helped. One day she calls me and tells me she broke her ribs. She didn't know how it happened, but she started having horrible pain, and her doctor told her, oh, they must be fractured. Long story short, it wasn't. Fractured ribs. At some point when the pain became too much to bear, she went to the ER and got a CT. Turns out she had stage 4 colon cancer, with 4-inch tumors in her abdomen that were compressing her organs and causing the pain. She died a few months later. She had been seeing doctors about her symptoms for 3 years. If one of them had taken her seriously and sent her to get a colonoscopy, she would probably still be alive. Story 6. Once when I was a medical student on surgery rotation, in trauma, we had a patient come in after he fell on the street and bonked his head. Well, apparently he had fallen once earlier that day and was discharged when the trauma workup at the other hospital was negative for injuries. We examined him and noticed his eyes were kinda yellow. So as part of our trauma workup, given that he couldn't give a great story and we couldn't be sure what happened, we CT scanned his abdomen and saw his common bile duct was like 3 times normal size. Could drive a truck through it. About that time, next set of vitals, his temp was 103. Guy was floridly septic from ascending cholangitis, which was why he was falling down. Big miss, and that is an emergency. I hope if a doctor ever examines me and my eyes are kind of yellow, they take me seriously. I'm glad that this guy managed to get help in time. At least it sounds like he did, but I'm glad he did, Just optimistic about it. Story 7. There was a story pretty recently in the hospital I work for where a cardiologist in the ER was doing a rather difficult night shift and started feeling lightheaded, dizzy, and fatigued. Given how intense those shifts are, 26 plus hours, sometimes multiple times a week, nobody thought much of it, and the doctor in question went to catch a quick nap in the staff room. People just passed by him in the staff room every once in a while, but they just assumed the poor guy was exhausted and let him rest. He was dead for several hours by the time someone realized something wasn't right. Story 8. One that comes to mind is when I was a resident. The ER doctor wanted to admit a mild septic patient with a UTI. I review her labs, and knowing that she's a diabetic, it was obvious florid DKA, diabetic ketoacidosis. That kind of admission typically goes straight to the ICU to get insulin via a drip and aggressive IV fluid rehydration. She was just in the ED hallway with no medications at all, looking like crap. This is why it's good to have multiple medical professionals all working together. Missing things like that probably happen, especially in such a hectic environment like the ED. So the first doctor missing it isn't like a huge deal, at least reflecting on them. It's a huge deal for the patient, obviously. But it's like a lot of things are going on. He's probably checking on 5 patients at once. So I'm glad that OP managed to check it and catch the mistake. That being said, obviously, I do wish doctors would get it right more often, but it's hard. Story 9. Speaking as a patient. When I was a kid, my eyes were hurting, and my dad kept taking me back to the same eye doctor, who insisted that the problem was that I wasn't cleaning my contacts properly and just kept giving me harsher and harsher chemicals to wash them in. It got to the point where I couldn't open my eyes fully in a room with the lights on, and I hadn't worn contacts for months. Finally, after a year, my mom forced my dad to take me to a different doctor. Literally, he met me in the waiting room, looked at me with his naked eye, and said, "You have a raging eye infection." A month of medicine and the infection was gone, but there was so much scarring and damage it was 20 years before I could wear contacts again. Story 10. Not a doctor, but actually the patient. I had a doctor prescribe me birth control. While in line to pay for it, I'm reading the paperwork that comes with it, and learn that another medication I'm on permanently and every day completely voids out any effect the birth control would have. I went back to the pharmacist and asked about interactions, and he says I may have side effects. I ask which ones, and he says, pregnancy. Pregnancy is not a side effect. It is a lifelong commitment. Then I call the doctor and ask why they would prescribe me something they knew wouldn't work. And she said, "But you asked for birth control." Like, yeah, I did, but I wanted some that would work. Silly me for not specifying that. Story 11. I'm not a doctor. I'm a nurse, but not in med-surg. My sister had her gallbladder out, routine surgery, and 2 days later woke up at 4 a.m. in searing pain. Went to the ER by ambulance. I met her there. The ER docs were all apparently convinced she was a drug seeker and did not even conduct a physical exam beyond taking her vitals. They snowed her to shut her up because she was just yelling, help me, I'm dying." They did eventually do an MRI but said it was negative and sent her home. She didn't want to leave, insisted something was terribly wrong, but they said they would call security and have her thrown out. At this point, I would like to mention that she has no history of drug or alcohol abuse. She continued to get worse at home and the next day went to a different hospital. They did a workup and found that the metal clip that closed off the bile duct had cut right through the tissue, and she had a large bile leak that was literally burning all of her abdominal organs. She had to have 3 surgeries to fix it and was hospitalized for 9 days, left with chronic pain from adhesions and chemical burns. When the new hospital finally acquired the MRI from the original ER visit, she was told that the leak was small, but clearly visible in the image. Story 12. Not a doctor, but the patient. When I was born, I was my dad's 3rd child. 2 from a previous marriage. He knew something was wrong with me because of the way I was breathing, very rapid, short breaths. When I was 3 months old, they noticed there wasn't really a change. The first hospital me and my mom took me to said that there was nothing to worry about, and babies just breathe like that. He was 100% certain they were wrong. They took me to a second hospital, and they said there's definitely something wrong. But they didn't have the technology to help, 1986. They recommended us to a third hospital, which was a couple of hours away. Finally, the third hospital took me right in and performed surgery that day. Turns out, I had 5 holes in my heart. They tried to go through my rib cage, but it didn't work. They had to crack my sternum and go directly through my chest. They took my heart out of its body and patched the holes. I'm doing wonderfully medically today and am forever in their debt. Not financially, though. Thank you, Ronald McDonald House. What a huge L as a doctor, though. Like, just think about this. You're a doctor, you look at this baby and you're like, babies just breathe like that. Can you imagine being told a week later, it's like, doc, the baby that came in like a week ago, I had 5 holes in their heart. What are you supposed to say as a doctor then? If that was me, I would never want to work again. I would feel terrible. Story 13. Ooh, I've got a good one, albeit sad. I was working nights and a patient came in for a nail bed repair under general anesthesia. It was a slow night. As they're getting him on anesthetic, he aspirates, so we do a chest x-ray to see if he's got any spit or blood in his lungs. What we didn't know is that prior to this emergency surgery, he'd been going to his GP for over 6 months complaining about chest tightness. They had put him on several different asthma medications, but none had any effect on him. The x-ray showed a massive, dark mass in his left lung. We kept him asleep and transferred him to the ICU. His wife and 3-year-old daughter were waiting for him in the ward. We had to tell them where he'd gone, why he'd gone there, and what was going to happen. Unfortunately, he died from lung cancer within the month. Story 14. Probably the worst story one can hear. My wife found a lump under her breast that was really concerning. It took her about 2 months to get a proper appointment to have it looked at. Doc diagnosed it as a cyst and fibroadenoma. She drained the lump and it was fine. Grew back a week later and was bigger. Finally, after being in pain for weeks on end, the doc says this is clearly not working, so we will do surgery and remove it. Upon going in for the checkup, thinking they'd take a look at the scar and healing, it turns out that she had stage 2A triple-negative breast cancer. The surgeon was absolutely floored. The most upsetting thing was that while her main surgeon/gyno, who is fantastic, was on holiday, another male doctor told her any surgery would be merely cosmetic, and it clearly didn't bother her because he could touch the lump. I almost laid that doctor out in the office. When she got the diagnosis, he apologized to both of us for being a jerk. Unfortunately, this story doesn't end well. Despite doing 8 months of therapy, chemo, and radio, her cancer returned 7 months later, and ultimately led to her death after it spread to her brain and spinal fluid. So many people told me, breast cancer, that's one of the easy ones. My insert relative had it. She switched gynos twice because they wouldn't take it seriously. It's been 6 months now, and not a day goes by where I wish I could have taken her cancer away. She was 27 years old. Story 15. Not a doctor, but I've been dealing with abdominal pain since I was a child. Countless ultrasounds, doctor appointments, ER visits. I was told it's in my head. Recently had surgery for something unrelated. During the surgery, they had to free my appendix that was stuck to my abdomen wall, and just the tip is healthy at this point. I've been suffering for years with a mild case of appendicitis, and my body was pretty much just absorbing my appendix. I will have to go back to get it removed at a later surgery because it was so stuck all they could do was free it. They didn't want to risk it at that point because it was going to cause more pain. So that was cool to find out. Story 16. I'm the patient in the story. When I was a toddler and started walking, my extended family noticed that I would waddle a lot. My parents didn't really notice it because they grew used to my funny walking. But my grandma and aunts that saw me much less often insisted that I had a limp. So my doctor asked our pediatrician about it, and he reassured that it was nothing and would fix itself when growing. 1 year passed and it didn't fix itself. It got more noticeable. My mother asked my doctor about it again. She asked for an x-ray to make sure that everything was fine, and the doctor bit her head off for wanting to expose me to the rays. He insisted it was nothing, but referred us to a specialist anyway. The specialist suggested my parents put some wool around my leg that had the limp, because wool would warm it up and speed up the growing process. Right. My dad finally had enough. It was summer and my regular pediatrician was on holiday. His partner visited me because meanwhile the limping became really bad and my parents wanted another opinion. The new doc measured my legs. There was a difference of 4 or 5 centimeters between the two. They sent me to a specialist children's hospital to get it fixed right away. I had severe dysplasia, so severe my right hip didn't have a socket for the femur bone. 3 years and 3 surgeries later, months of physiotherapy to learn to walk again, I was normal. If the second doc didn't catch it, I would have grown up disabled. He split up with his work partner. Second doctor is now my daughter's pediatrician. Story 17. Not a doctor, not even a nurse. While working as a CNA on an ICU step-down unit, I noticed my patient was acting strange. Asked her a few questions and got some questionable answers. Thought it might be weird, as she couldn't really answer questions other than huh and uh-huh. Her gait was weird, like a trot rather than a normal walk, and she was leaning. I was training another CNA, and I was like, no matter what you do, if you see something, notify the nurse and chart that you've notified her. The patient was having a major stroke, and the nurse was so far up her own butt and her own phone to do an assessment. The woman had to go to rehab and was not a candidate for any stroke reversing drips, as I had charted that she seemed off 8 hours before. The only reason anyone caught it was because the night shift nurse insisted on bedside report. The nurse I had been working with yelled at me, "Stroke?" like I hadn't been notifying her of symptoms all day. Story 18. Yet another not a doctor. But my grandmother had a lump on her tongue, and when she went to the doctors, the person who examined her said it looked benign, but didn't feel comfortable, so said she should go to an expert lest it become malignant. A more senior doctor decided against that and blocked the proposition. A couple months later, it is malignant, and she needs half her tongue cut out plus tonsils. Story 19. I'm the patient in this story, but I still think it's worth saying. I started having horrible ankle pains when I would walk in grade school, and my doctor always attributed it to growing pains. I knew that it was BS, and so I kept annoying him about it. After multiple attempts at diagnosis, everything from knock knees to pigeon toe to just being weak, I finally went to a specialist. He asks me to flex my ankle, and I do so. No, all the way, he said, even though I was flexing as hard as I could. I could only flex my foot maybe an inch from its resting position. Turns out I had incredibly decreased mobility of that joint due to shortened tendons. He diagnosed me within 5 minutes after years of doctors brushing it off. After a few months of physiotherapy and a shoe insert, my pain decreased by a lot. Story 20. I'm a dentist in the UK. While I was working as a locum in an emergency clinic, had a man present with a mouth of infections. He wanted implants. Went to a private UK dentist who refused to do them due to the patient's heavy smoking and poor oral hygiene, which would mean the chance of success and good healing would be limited. The patient didn't accept this. Went online and found out that he could go to Hungary and get the implants done for half the price and have a holiday. Came back and within a few weeks, most of the implants are infected and he sat in my chair. We gave him antibiotics to clear up the infection, but then had to inform him that the implants would need to come out, and he would need to find a specialist dentist with the necessary equipment to get that done. He was not happy. Spent all that money only to have to pay again and to have them all removed. No better off and at least 10 grand down. Should have listened when the first person told him no. This is the flip side of a patient not listening to their doctor. Oral hygiene is really important. Mouth infections are no joke. Story 21. Yet another not a doctor, but my mother-in-law had all the signs of a stroke. Severe headache, vomiting, vertigo, vision problems, partial paralysis, but was sent home from the ER and was told it was an inner ear condition that would resolve on its own. When it did not get better, she saw her GP, who upon merely looking at her asked her when she had the stroke. When he realized it was still untreated, he immediately sent her back to the hospital. There, they finally recognized that she had a major stroke. She could have easily died and was in rehab for weeks. They then claimed that it must have happened after she was there the first time because, and this is really unbelievable, her chart from that visit did not say that she had a stroke. So much wrong with that statement that I don't even know where to begin.